It's another episode of the About Mansfield Consumer Advice Series. I'm your host, Steve Cosio. We appreciate you being here today. And as always, over here on my right, that would be your left, Dr. Joseph Adams. He is the chiropractor at Calibration, Chiropractic and Functional Health. Welcome back to About Mansfield.
Thanks for having me, Steve.
And today we are doing our continuing series on migraines. And so let's just go ahead and jump right in it. What causes people to suffer from a migraine attack?
Yeah, so last time we chatted a little bit about what the causes of migraines are, and the big thing to take away from that is that migraine patients are just sensitive, okay? So they don't have normal brains.
Let's back up.
Sure.
Because of the click. So what causes people to suffer from a migraine attack?
So like we talked about on the last episode, people who have migraines have sensitive brains.
Right.
And so they are sensitive to various stimuli that normal people are not. And so to help them mitigate the amount of migraine pain that they have, we have to reduce those triggers. And the trigger list is very large. The grouping of triggers is, about 5 things. And so that's one of the things that we need to cover is how these things trigger migraines and what people can do to help themselves at home in their daily lifestyle.
Some of the triggers I hear about, red wine.
Mm-hmm.
Is that not a trigger?
That is one of the triggers, yeah.
Oh, and I love red wine, but I don't suffer from migraines. But so what are some of the other triggers? And if you want to go deeper into red wine?
Yeah. So with, red wine, basically what's going on is that people are not able to convert certain components of the red wine. And so tyramine is one of them that you find in certain foods. Another one is sulfurases. And, those tyramine and sulfurases that are in certain foods, not only just, red wine, but aged cheeses and citrus fruits also produce a histamine reaction in the body. All 3 of those things in foods can give people a migraine event if their bucket, if you will, gets overfilled with all the different triggers. So we just have to, remember that it's not just the food group. There's also 4 other groups of triggers that can cause people to have their bucket overfill and then have a migraine event.
So as they say that everything is okay in moderation. So if you're saying there's a bucket, if I have too much red wine, it's going to fill that bucket. We're going to have a migraine, or with aged cheeses or what have you. Can I have a little bit of red wine, and it may not? Let's just. You're shaking your head. Yes.
Yeah. So that's actually a really fine point here because everybody is different, and that's really what makes treating migraines so challenging. Is that if you have, let's say, low other triggers. So, your structure is healthy and you have no hormonal issues, you have little to no stress, you have no neurologic issues, and it just happens to be that food is your triggering group, then for you, having a little bit of red wine may not trigger anything.
Yeah.
But if we flip that coin and we have somebody that has, issues with their neck, they've got, hormone issues, they're under a massive amount of stress, they have neurologic problems, then that person, even the smallest amount of, wine, aged cheese, aged meats, citrus fruits could cause a migraine.
So on if your bucket is full at 100%, your physical stature also plays into it. So there's a percentage of your bucket. Your diet plays into it. There's a percentage of the bucket.
Correct.
So if you are in great health, your bucket may be 10%. A little bit of wine may add another 10%. What we're trying to alleviate is getting to 100%.
That is exactly it. So that's what people have to realize is that you have to assess your trigger load based off of the 5 groups. And just to make that really clear, it is, structure. So, how healthy primarily is the neck region. And there are studies that show that the more degeneration you have in your neck, the higher migraine load you'll have if you're a migrainer. So for some people that come into my office and I, do a history with them, from the history, I can already tell, maybe this neck problem, degeneration in an older, patient is the bigger factor in triggering their migraines because they don't have maybe some of the other ones. And the other one would be hormones, right? So hormones is really big because unfortunately migraines really only affect females. And females have a more complicated hormonal system than males do. And so you have to, sit with that person and discuss their hormonal health. And so some of the things that can be going on with hormones that really affect people is, are their DHA levels low? Are their estrogen progesterone ratios off? Are their melatonin levels off? Is the cortisol levels off? And so you have to, look into hormones as well. And then, the food that we've been talking about a good amount already is another one. And that food list is huge.
Yeah.
It's huge. But the thing is, I've noticed over the years, most people are so focused on eliminating triggers. What they usually miss is keeping their blood sugar steady throughout the day.
Okay. So snacking throughout the day instead of having big meals, breakfast, lunch, and dinner.
So it could technically be done either way. It really kind of depends on the person. But the key takeaway here is that you cannot skip meals. Mm-hmm. And if you are somebody who has a low blood sugar, and that is best assessed with a blood test, let's say if you go in for a fasting glucose level and you are always just a little below 100, then you may be a little bit more of a hypoglycemic type of person. And if you're a hypoglycemic type of person, then you absolutely cannot skip meals. And then you probably need to be having snacks every 2 hours that are high in healthy fats and or protein.
Give me an example of a healthy fat.
My favorite one would be a cashew.
Oh, okay.
So pretty much all of your nut groups are going to be the best way to get healthy fats and protein out of a snack. Just no peanuts because peanuts are not a nut.
Oh, they're a
legume.
That's what I was going to say. Or in French, a légume. That's right. Peanuts are not. And so nuts and cashews are wonderful. And so I keep hearing about the 5 triggers. Have we gone through all 5?
There's one more, and this is the one that is missed the most, and that's the neurologic aspect of it. And so a lot of migraine patients have subtle neurologic deficits. And what I mean by that is they're not ones that are going to be pathologic. So if you go to a neurologist, they're not going to be looking for or not finding pathology in you. But the way that we practice, we're looking for subtle deficits that would not be classified as pathologic. And some of those examples are balance issues. So a lot of migraine patients have really bad balance. And so one of the ways you could just test this is just stand with your feet together, arms out in front of you, and close your eyes. If you have a lot of sway in that standing position, then maybe you have a balance problem. And that's one of those neurologic deficits that is triggering your migraines. Another one is eye movements. So just to be clear, we look at people's eye movements, which is more of a motor control of vision,
right,
and the coordination of 2 eyeballs that have 6 muscles attached to each of them so that your eyes can sync up on a target at all times and be accurate. A lot of migraine patients have issues with this. So one eye maybe doesn't come in at the same rate as the other eye.
Does strengthening the 6 muscles in the eye, does that help? Again, wow. It's like, I know I'm not a doctor, but so strengthening the 6 muscles and doing eye muscle exercises.
Exactly. So that's what we do. So this is called dynamic vision, and it's not looked at by your optometrist. The only specialties that really look at this is neurooptometry, and there's not many neurooptometrists. In the Dallas area, I think we have maybe 4. Wow. And to get into one of these guys is pretty hard because there's high demand. So eye movements, just strengthening those strengthens the nerve itself and the connection to the brain to control the eye movements. And that takes another thing off your list that's dysfunctional. Another one would be autonomic problems. And so autonomic problems are when your body isn't able to regulate the automatic processes that you don't have to think about. Okay. So that's things like your blood pressure. You don't have to think about regulating your blood pressure. You don't have to worry about constricting your pupils when you're in a bright room.
True.
And these are some of the things that we find on migraine patients is that sometimes, the side of the affected brain, would say the part that is not regulated as well as the other side, one of those pupils sometimes is bigger. So a lot of times, I'll see a migraine patient, I walk in the room to do an exam, and I'm staring at them, and their right pupil is like twice the size of their left. And that's with, sun,
and
sunlight shining.
You know exactly what's going on.
Yeah, immediately I'm like, there's some autonomic problems here.
Let's go over those 5 triggers again. You had mentioned neurological, diet, physical structure. That's 3 of the 5. The other 2 were...
So you're also going to have hormones.
Hormones.
Yep. And then stress levels.
Okay.
And those kind of go together, like lifestyle and stress, because it's really hard to treat a migraine patient, let's say, that's in like the most stressful time of their life, because that changes the hormones.
Sure. That makes sense. Let's see if I got these 5 again. Stress level, hormones, physical, neurological, and diet.
Yes.
There you go.
That's it.
If someone wanted to reach out to Dr. Joseph Adams at Calibration Chiropractic, how can they get a hold of you?
Yeah, we're pretty easy to find. You can just do a Google search for Calibration Chiropractic and Functional Health. We're on all social platforms. So it's pretty easy to get a hold of us, and we are right here in downtown Mansfield.
That, my friends, is a 10-minute nugget of information. That is 10 minutes with Dr. Joseph Adams, Calibration Chiropractic and Functional Health. Dr. Joe, appreciate you being here, and we'll see you again next week.
All right, buddy.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.